When people talk of Dr. Reddy, they like to know what's his impact. I mean, what's he really do when he takes over a hospital? What is Dr. Reddy going to do that's going to impact me?
Well, I think the first thing that's important, and that is the hospital is still here. A few years ago, we were threatened with the closure of this hospital.
We're very thankful here at Alvarado Hospital to have Prem Reddy at the helm to help guide us into financial security so that the hospital can remain open and a major resource for the community here.
We partner with the communities we serve in not only saving their community hospitals, but improving the overall health of the community with health education and free community clinics in all the communities we serve.
I say he's impacted the entire state. He has changed medicine in the state of California. He is being asked by other states of Nevada, of Pennsylvania, of Texas to come there.
Most of our hospitals have been failing facilities. They're not big, profitable institutions, and it's a challenge for us to, and for him, to be able to do this, invest. Usually when we buy these facilities, or when he buys these facilities, he will invest millions of dollars.
I think that it would not be exaggerating to say that the emergency staff, and myself included, are very excited, if not thrilled, by the idea that we will actually get more emergency beds.
He has the vision, and he allows the hospitals to operate. The doctors take care of themselves like they have under any other ownership. I have been in on 7 of the acquisitions. I have had the opportunity to go and talk to the doctors coming on, as well as the staff coming on.
Him being on the cutting edge of this new information age that we have evolved into, computerized everything. And from my perspective, we as a community owe Dr. Reddy the time to continually improve his operation and mold it so that it suits the health needs of the people that are in this region.
When he takes these distressed hospitals and keeps them open instead of allowing them closed, certainly he keeps employment where it is. In most places, because he increases the business, he increases the employment. I can tell you that the employees are respected. I can tell you that employees look forward to coming to work. We are family.
We have a staff that cares, and we're all family.
His success is phenomenal. His track record was impeccable, but mostly it was his treatment of physicians, because he was always very fair with the doctors. At a time when many doctors felt that insurance companies and medical groups were taking advantage of them because of contractual issues, it was Dr. Reddy that would step up and pay a little more, or give a little recognition, or just make sure that the process was fair.
He's redesigned the staffing model and basically done an overhaul of the emergency department to make the entire process healthier, and will give it a real longevity.
Dr. Reddy has provided us with the ability here at a hospital to see patients within 12 minutes of arrival, to have emergency wait times to be around 2 hours across all of his hospitals, not just an isolated one, and to have satisfaction scores in the high 80s and 90% from patients that are happy to come and be seen.
Because of our commitment to quality, Prime Healthcare has been ranked top 10 and top 15 health system in the entire nation. Our emphasis is on patient care quality and efficiencies resulting in cost effectiveness.
Without leaders like Prem Reddy, we would not be able to survive, and this hospital would be facing serious financial questions, and the survival of the hospital would be questionable. So the challenge for us has always been efficiency. So as a byproduct, we've become one of the most efficient emergency departments in town.
I think he's the type of individual that decided early in life that he wanted to make a difference.
Look at where I came from. I came from a very poor family, in a poor village, in a third world country, and with no electricity or potable water, and barely a school, barely. And from there, I went on to becoming a doctor, a cardiologist, and not only I practiced cardiology for 30 years, now I offer services through various hospitals.
He will hardly ever talk about finances. You will hear him talking about quality of care, how can we improve the care of our patients, how can we improve our core measures, how can we improve our satisfactions.
Now, what Dr. Reddy has done in terms of healthcare, and I think pioneering, and that is to really focus on and be very, very precise about making sure that you're on top of diagnoses, making sure that the type of patients that you're taking care of, that you document that very appropriately. And so this hospital is a central part of maintaining the health of this community.
When people ask me what I think of Dr. Reddy, I can sum it up for him is that he is a visionary, he's a man of his word, and he really, really cares about things that matter, which is, well, providing good care. Hospital closure is a tragedy, and what's important is the patient. It's not anything else, it's the patient. And one of the things that I'm very pleased about is that the affiliation I have with this company, with Prime, is that that's never forgotten.
What if this emergency department were closed or this hospital were closed? I think it would be devastating to the community around us, because then if you called 911, you'd be taken farther away, down a freeway, one direction or the other, into a potentially impacted emergency department. I think most patients will attest to the long wait times they experience at most of the hospitals in the area. Those wait times would become even longer, and this would have an impact on patient care and patient outcomes. It's vitally important that this hospital remain open.
We're going to find a crisis situation in healthcare in terms of hospitals. Hospitals are going to come to the public and say, you know, we're going to be closing because we can't do this, we can't do that, mainly because they haven't adapted a model that is a model consistent with what you have to do as a business to move healthcare along so that you are on top of your game and that you can still deliver quality care.
Without Prime Healthcare's intervention, most of these community hospitals would have closed their doors. These community hospitals provide the essential healthcare needs of various communities.